figures. It's now been 3 years since the World Health Organization first called COVID a pandemic.
And while many of us have gone back to our normal lives, convinced that we're protected by immunity built by infections and vaccines, the truth is the virus is still spreading, and it's still making a lot of people very sick. Data from the CDC shows that almost 3,000 people were hospitalized with COVID in the U.S. over the past week, and more than 1,800 people died. As WBZ's political analyst John Keller explains, while the danger is still real, now it's what comes months and years from now that should also have us on guard.
The pandemic is over.
That was last fall. Since then, the signs of public concern with the virus, masking, testing, and distancing, have all but vanished. But for those who've dropped COVID risk from their list of things to worry about, here's a wake-up call. Without fanfare, the CDC has warned medical professionals who issue death certificates that long COVID, previously defined as an unusual lingering of COVID symptoms, can, quote, have lasting effects on nearly every organ and organ system of the body, weeks, months, and potentially years after infection. And that certifiers should consider whether deaths were, quote, due to long-term complications of COVID-19, even if the original infection occurred months or years before death.
And this weeks, months, and years statement, especially on death certificates, is the very first time I've ever read this.
Dr. Eric Feigl-Ding, a former Harvard faculty member who heads the COVID task force at the New England Complex Systems Institute.
Previously, the CDC just said, oh, your symptoms may last a long time, but your underlying cause of deaths years from now, potentially years from now, months from now, could actually be still due to COVID.
With a new study from the Journal of the American Medical Association reporting the death rate of long COVID sufferers is more than double that of patients without COVID, Dr. Feigl-Ding says it's time for people with any of the 21 COVID risk factors cited by the CDC to realize the danger hasn't vanished, even if the masks have.
A huge wake-up call that honestly the CDC should have put out a larger, louder alarm about.
This episode is a reminder that our knowledge of COVID is still very much a work in progress. And while politicians, acutely aware of the palpable COVID fatigue that's overtaken our culture, may have moved on, the virus has not, with consequences we're only beginning to understand. John Keller at Large, WBZ News.